Now, Amnesty International is warning against changes to the National Health Act regulations. It says it will be a violation of human rights, or rather there's a risk that it could lead to a violation of human rights. The amendments are related to the surveillance and control of notifiable medical conditions. The organization says they are not aligned with the Constitution or international human rights laws. Let's get more on this. Marike Keller, a researcher at Amnesty International South Africa, joining us now virtually from Durban. Marike, good afternoon. The minister also mentioned this earlier today, that's Dr. Joe Patla, in terms of the process. I think public comments are now closed, but there's been lots of concerns. You are concerned about the risks to violation of human rights. Why?
Hi, Dan. Thank you for having me. So, as Amnesty International, we recognize the need to prevent and control the spread of COVID and other notifiable medical conditions beyond the state of disaster. But we are concerned by some of the proposed amendments to the regulations and the possibility that these may risk breaching human rights. So we've got a number of concerns with specific regulations, but to mention two broad concerns. The first is the permanent nature thereof. They are not time-bound. So many of the regulations, as they are phrased currently, for example, regarding isolation, quarantine, contact tracing, and the refusal of medical examination and treatment, are not time-bound. So this makes them potentially permanent as opposed to temporary measures that are introduced under the national state of disaster. And this ambiguity and uncertainty may open them up to abuse. So we're recommending that there is an inclusion of specific timeframes for each section of the regulations, as well as clear provisions stating when exactly they are triggered and when their application ceases. And the second general concern that we have is the criminalization of non-compliance with the regulations. So this comes with a potential prison sentence of up to 10 years with non-compliance and or a limitless fine, which is determined by the courts. And long-standing international legal principles require governments to avoid using criminalization as a way to achieve public health objectives. So this usually fosters stigma, discrimination, and also disproportionately affects marginalized groups. So instead, what states should be doing is addressing underlying determinants of health, such as poverty and a lack of housing. So here what we're recommending is that an amendment is included to remove all offences and penalties contained in the regulations so that non-compliance is not criminalised.
Yeah, so you say there's a number of concerns. You've highlighted the main ones, the permanent nature of these regulations and the fact that they could lead to criminalization. So what can you do now? I understand the public comment phase is done. Government is now going to proceed. They are targeting some time in May to begin implementing these or publishing them in the government gazette. What can an organization like Amnesty International do to gain expression and response to your concerns?
Well, the first step is through a submission, which we have made about a week ago, stating very clearly why a number of the regulations that are included in the proposed amendments potentially have the risk of violating human rights. So it is important in this public participation process to include, for those voices to be included. And from what we've seen, there is a general public outcry with these proposed amended regulations, and it's very important for the public to have made submissions as well. And with that, there was an extension for submissions as well up until 24th of April to allow for more public comments to be made. Second component is through media to make the public aware and to address the Department of Health that there are very serious and genuine concerns that organizations like Amnesty International have with the proposed amendments, and that we have made very clear recommendations as to how we feel that these can be strengthened and improved going forward.
Okay, thank you very much. Amnesty International South Africa's researcher Marike Keller talking to us there virtually from Durban this hour. More